So, good afternoon, everyone. Welcome. My name is Sharon Foster, Professional Practice Associate and Education Coordinator for WeRPN. Today, I welcome you to our Science of Foot Care webinar and our guest speaker, Erin King. Our webinar today will be approximately 1 hour long, and we ask you to hold your questions until the end of the presentation so that we have uninterrupted presentations. And so our speakers then able to focus their attention and answer your questions individually. So on behalf of WeRPN, I'd like to acknowledge Feet for Life as a sponsor for Nursing Week 2022. Nursing Week registrants have been entered in our draw to win a self-care gift basket and a copy of Erin's published textbook, Feet for Life, Portofo, Nursing Advanced Foot Care and Lower Limb Care textbook. The gift is worth $500. We'll announce the winner of the prize pack at the end of the presentation. This afternoon, I have the privilege of introducing Erin King, CEO of Feet for Life Medical Foot Care Limited and Director of Care for her private education facilities, Feet for Life School of Portofo Nursing. Erin is also the president of the Ontario Portofo Nursing Association Ontario, Inc. This is a registered not-for-profit organization and an accomplished published author of Feet for Life, Portofo, Nursing Advanced Foot Care and Lower Limb Care 2020. Erin's educational achievements include, but are not limited to, obtaining a postgraduate study in medical foot and lower limb care, diabetic foot care, laser, shockwave, and orthotic therapy, gait analysis, biomechanics of the foot and lower limb, compression therapy, wound care, reflexology, advertising, and entrepreneurship. Erin's nursing career journey has been primarily focused on the subdiscipline of medical foot and lower limb care and promotion of Portofo nurses, that's RPNs, RNs, and NPs. Erin's committed to advancing the specialty area of nursing foot and lower limb care to meet the needs of the public. Erin opened her foot care clinic in Barrie, Ontario, Feet for Life Medical Foot Care Limited, in 2002 through her nurse-led model of care. Erin has been a foot care educator at Georgian College and now oversees her education curriculum, which is being delivered across Ontario at 7 clinic teaching locations. Erin's education curriculum is delivered by RPNs and RNs who own their own clinics and are seasoned Portofo nurses with a wealth of knowledge and skills to provide the nurse student with the skills and knowledge to become independent practitioners through a comprehensive, all-encompassing learning environment. So welcome, Erin. You're certainly a very accomplished nurse and expert on foot care, and we look forward to your presentation. I'll now hand it over to Erin King.
Thank you very much, Sharon, and thank you to WeRPN for hosting me so I can share my knowledge and experience in foot and lower limb care. And happy Nurses Week to everybody who's joining me today. I can't see all of you, but so this will be different talking to myself, but hey, I like to talk. So what I'm going to do is start with just about how wonderful a profession nursing foot and lower limb care is. Truly, myself and my staff, my colleagues, I think we all share the same sentiments that this is a happy career and a great specialty area for nurses. When I began nursing foot and lower limb care in 2002, I think I was about 27 years old at the time. And I always felt that foot care was very artistic in its scope, practice, and cure. And it truly does play a vital role in one's health-related quality of life. So through my experiences working in this field of care, I have been able to create a quality work-life balance. And my goal has always been to share that with other nurses and colleagues so that we can live happy lives and enjoy our careers at the same time. So I'm going to start with some foot facts, if I can get my screen to move, which for some reason it's not. Let me see if I can do this. Sorry, my apologies. Here we go. So interesting foot facts. A lot of people ask questions about feet, particularly clients. So it's really nice to be able to sort of give them an idea of how much our feet actually really do. So the average person walks up to about 160,000 kilometers a day. So, and I'll often tell my clients that ask me, why do I have these foot problems? What's going on? So I like to tell them the average person walks about 4 times around the earth in their lifetime. So that's a lot of pressure and a lot of work that our feet do for us. There are more nerve endings per square centimeter in the foot than any other part of the body. So our feet constantly supply us with information about the surface we walk on without even being aware of it. Our feet sense hot or cold, rough, smooth surfaces, which side it slopes to, let's say golfers walking on different types of terrain. And they will sense discomfort and pain, which is imperative to foot and lower limb health. Feet often mirror one's general health, which reflects conditions such as arthritis, diabetes, nerve damage, and circulatory disorders. Foot ailments can be the first sign of various medical conditions, and often our podoortho nurses will find things in our clients before their doctor would even discover it. For example, diabetes, if we're noticing that there's some loss of protective sensation, then we would refer them to their doctor for a hemoglobin A1C to ensure that they haven't developed diabetes throughout the aging process. While ambulatory and active, each step can exert pressure that exceeds one's body weight, up to 3 to 4 times more body weight, adding up to a cumulative force that can amount to over 500 tons a day. A lot of my students or potential students will ask me, what kind of work is available in this industry? And will I have a job after I complete your course? So I discovered through Statistics Canada that in Ontario, and this is a 2011 census, so I'm sure it's grown since then, that there's 12.85 million people. So how many pairs of feet does that equal in Ontario? 6.4 million pairs of feet. So yeah, there is definitely a lot of work for nurses who choose to specialize in this area of care. So the role of the nurse as a regulated healthcare provider is important. Utilizing their nursing knowledge, skills, and judgment from their entry to practice allows them to specialize in certain areas of care, and foot and lower limb care is no different. We help our communities improve or maintain their health-related quality of life. So today I'm going to talk about a few topics. I don't have a lot of time to talk about everything. I wish I did. Foot and lower limb care is quite involved. So what I've decided to talk to you about today is the inception of podoortho nursing. So how we came about and where we got this name that is sometimes difficult for people to pronounce. Hopefully it gets better. And then nursing need for foot and lower limb care. So where are the needs and where are the opportunities? We're going to talk about scope of practice in nursing foot and lower limb care. This has often been sort of misunderstood in the industry. So it's important to communicate, where we feel we can practice and what types of conditions we would be treating. We're going to talk about common conditions treated by a podoortho nurse. And a lot of our students will ask, how do you build a successful career or practice and what opportunities exist? And then where should you begin? So the term podortho is a registered trademark title, legally trademarked by the Ontario Podortho Nursing Association. It is derived from Greek terminology suggesting the foot is correct and straight. This concept was conceived in 2014 when the Ontario Podortho Nursing Association developed by nurses working in the field of foot and lower limb care, who felt the career title foot care nurse wasn't as descriptive as the many advanced skills and services these nurses were providing in communities, and it went beyond foot care. And that's no different than other nursing practices. You often wear many hats. So a lot of these nurses had been delivering care for decades to meet the needs of the public and working within their legal scope of practice. However, they were finding that there was so much more that the nurse could do within their scope of practice to treat their patients effectively and provide them with a great deal of result-oriented care. So a nurse's entry to practice competencies can be augmented through continuing education, as we know, which is highly promoted, and to specialize in medical foot and lower limb care. Nurse leaders in this specialized area of healthcare recognize the need for more regulated healthcare providers that could provide more comprehensive care to meet the growing complexity and the needs required for our aging and active population. Podortho nurses provide a whole of patient care approach when delivering nursing foot and lower limb care. So we're not necessarily just addressing a corn on someone's foot. We may be talking to them about some other conditions that they may be faced with that is having a negative impact on their mobility, for example. So back in 2014, the Health Professions Regulatory Advisory Council studied the model of foot care in Ontario. The College of Nurses was asked to provide some feedback in this study, and they have provided a statement which helps to clarify what a nurse's role is in this specialized area. So registered nurses, registered practical nurses, and nurse practitioners, collectively referred to as nurses, are regulated healthcare professionals who provide foot care in a variety of care settings, long-term care homes, hospitals, family health teams, physicians' offices, and in the community, in patients' homes, or in private health clinics. Nurses assess patients, provide preventative care, and educate and refer patients to other practitioners where necessary. Nurses also provide non-invasive foot care services such as clipping nails, paring calluses and corns, debriding morbid tissue, treating ulcers, providing wound care, monitoring conditions of the foot, prescribing and dispensing orthotics, and wrapping and bandaging the feet. So there is a lot more than we realize that we can do to assist our patients. And we encourage our students to work to their full scope of practice to be able to deliver that quality care. So I just want to talk to you about, just quickly, about the Ontario Podortho Nursing Association. Some people, want to know sort of how the Ontario Podortho Nursing Association developed and started. So back in 2014, as I mentioned earlier, sorry, I'm just moving slides around here. OPNA was legally registered with the Ontario government. It is a not-for-profit organization, and the objectives of OPNA is to support nurses in their foot and lower limb care objectives. So RNs, RPNs, nurse practitioners are guided by nursing best practice standards and guidelines developed by a regulatory body, as we know. Podortho nurse is a registered trademark career title registered to OPNA. OPNA has established standard education and practice requirements to carry this trademark career title, Podortho, and then nurse. So CNO has provided feedback within our Podortho nurse core competencies document. So whether you're an RN, an RPN, or a nurse practitioner, that title comes first, and then Podortho nurse after that. OPNA communicates educational requirements to ensure that our skills and competencies continue to advance to meet the needs of the public. And OPNA does require membership and renewal and annual renewal. Sorry, I just have to move all these things around. So OPNA aims to decrease barriers that prevent the public from accessing essential care from our qualified nurses who are regulated healthcare providers. We want to make sure that when we're working in this area of care, that we're recognized and that our patients can come see us, that they are getting covered by their insurance plans, and that they are being respected for the quality care provided in our communities. Okay, so my apologies, I'm just moving really slow here. I keep having to move this thing around. Okay, so the Ontario Podortho Nursing Association has provided a practice statement. Podortho nurses are registered nurses, so registered practical nurses, registered nurses, nurse practitioners who are regulated healthcare providers that specialize in the field of advanced medical foot and lower limb care. The primary objective of a Podortho nurse is to optimize foot and lower limb health, improve client mobility, and overall health-related quality of life. This is achieved by performing lower leg and foot assessments, which has been known to detect early signs of life-threatening diseases or disabling conditions. In conjunction, Podortho nurses use the nursing process to diagnose, develop, and implement a plan of care and evaluate patient outcomes while working as part of an interdisciplinary healthcare team or independently to provide quality client care. So in terms of education, so the foot care industry historically has lacked unity and consistency among foot care programs. So some levels of education and skilled training varies from more basic to more advanced. Competencies to deliver the comprehensive quality care needed to meet the complex and required care in our communities. And we're seeing that more and more in our clinical settings, that the need is growing, and that nurses are faced with more complex cases. So Fee for Life School Podortho Nursing Program offers established clinic settings and advanced theoretical information provided to each nurse with extensive knowledge on how to translate this knowledge and applying it to all the skills required to deliver competent and confident care. It's really important for our educators within our program that our nurses leave the program and they feel really comfortable and competent in their care. There's a lot to learn. So our facilitators own their own clinics and they educate. And it's a consistent message, it's a consistent training that's quite comprehensive and advanced, and it's specifically geared to nurses. So we utilize my published textbook, as Sharon mentioned, that I published in 2020. And it's very specific to nurses. So it talks about, in the textbook, it talks about, here's the condition, and this is how a nurse would go about treating this particular condition and when to refer that to allied healthcare providers etc. So it really does address the scope of practice of nurses, because that has been something that's been a little bit confusing. And I know when I entered the field of nursing foot care, when I first started 22 years ago, there was some questions as to, can we do this or can we do that? So this program will help you build the confidence, the knowledge, skills, and judgment to be able to deliver comprehensive care. So our program advocates for a greater level of knowledge and skilled clinical training. So that's done one-on-one with a mentor, so that the patient's not overwhelmed, and neither is the student. So continued education is something that we also advocate for. OPNA offers that many courses complimentary to our members to ensure that everyone's keeping up with industry advancements and technologies. And there's a lot of adjunctive therapies and technologies that nurses can utilize in their practice, so that they can provide the care required when your client walks through the door. So OPNA also collaborates with other allied regulated healthcare providers. So some of them will offer additional training. So for example, we have doctors who are teaching orthotic therapy. If the nurse wishes to introduce orthotic therapy into their practice. We have a laser therapy program that's now available, complimentary to our members. So there's a lot of additional training and education as well. Okay. So some of the services offered in a nurse-led model of care. I'm just going to close this thing. Collapse this. So we promote overall health and well-being. We always do as nurses anyways, and being in a foot care practice is no different. We improve access to healthcare in the community, and nurses will help to prevent more serious foot complications and help their clients manage those potential foot complications. Enhance preventative care services and reduce the risk of illness, disease, and complications such as lower limb amputations. So we aim to improve or maintain our clients' mobility, allowing them to live pain-free and to remain active and well. So we continue to adapt to many changes in our healthcare environment, addressing the population needs. And this continues to grow, and our population continues to age. So the complexity of care that ortho nurses are seeing and treating continue to be a significant need in our communities. Ortho nurses work in independent practice and or sometimes in multidisciplinary care settings. So for example, we have a physiotherapist in our clinic. We also have a massage therapist. Some people choose to work, alongside a chiropractor. So there's lots of opportunities from that perspective. The one thing that I've noticed in my practice is we're kind of like private investigators, and nurses will often, determine the cause before it actually happens. So we will treat and prevent, and we will treat the cause rather than focusing on the symptom. And that's sort of the difference we find in our clinic. Than doctors that will often prescribe medications or recommend surgical intervention. We're looking at our client as a whole and saying, okay, let's get this person on a good care plan so that we can help prevent any potential complications that may arise with their feet and lower limbs. So what else? So ortho nurses will perform regular assessments and screening. They will do follow-up maintenance treatments with their clients, provide education, clinical support, professional product recommendations, and care coordination with the client's healthcare team. So our role is quite significant. So in this chart was created by the Ontario Ortho Nursing Association. It's a tongue twister, so I'm just going to say OPNA from now on. So you can see here the different levels of practice. So you can see here with the pedortho nurse, we are regulated healthcare providers. We perform both basic and high-risk foot care. Wound care, provided the nurse has obtained the knowledge, skill, and judgment to do so. Laser or phototherapy, also known as low light level laser therapy. And I'm going to get into that and what we do there. Nail bracing and reconstruction, which is newer to the industry from when I started 22 years ago, but it's quite effective and non-invasive for our high-risk clients. The nurse practitioner can prescribe medication, as we know, and communicate a medical diagnosis. We can communicate a nursing diagnosis. So for example, somebody comes in with a corn on their 5th metatarsal head that's causing pressure, they're a diabetic. Obviously that needs to be offloaded. So nursing diagnosis might be patient pressure noted at 5th metatarsal head related to pes cavus, requires offloading and regular care. So we are working on some nursing diagnoses specific to the field of nursing foot and lower limb care, so that our nurses will have access to those documents on the OPNA website. Our members will have access to that. Nurses do compression therapy and fitting and dispensing and determining the vascular status of the client. A lower limb vascular status, my apologies. Dispensing and prescribing orthotics. Now, there's been a lot of discussion around orthotics in our industry for quite some time. This is a central component of a pedortho nurse's care. It's important for us, for nurses to be able to offer this therapy. Often we will see clients that have developed corns or calluses on the plantar aspect of their feet and require those areas to be offloaded. Our diabetics with motor neuropathy, those bony prominences can cause a problem. So offloading, for example, those keratotic disorders are important to prevent them from coming back as quickly and to prevent any potential wounds from developing. Another thing that we do in terms of orthotic therapy is we will see patients that come in with foot pain, for example, in their arch. Plantar fasciitis is a very, very common condition. It's often seen in middle age to late age as the foot arch starts to collapse. Pressure and tearing can occur in the plantar fascia. So, how do we deal with that? We prescribe orthotics to support their arch, to put them back into a subtalar neutral position, to assist them with their mobility. Often, we'll hear of the general practitioner, the doctor, telling them, well, you have to stay off your feet. And that's not really realistic for most of us. And we certainly don't want our clients to be less active. Other health consequences can arise as a result of being off their feet. We also dispense and recommend orthopedic footwear. It's usually off-the-shelf orthopedic footwear. And then padding and strapping, and then fitting braces. So bracing is sort of a newer area for pedortho nurses, but something that we've been looking into. I personally see a lot of my daughter's volleyball team have come in with sprained ankles, for example. Very common in that sport. I've treated three 3 of the girls on her team, and quite effectively with laser therapy and ankle braces. So statistics. I just want to talk a little bit about regulated healthcare providers practicing foot and lower limb care in Ontario. And I get this question a lot from some of my potential students. So this statistic was updated in 2020, and I'm sure it's likely grown, but currently there are only 600 chiropodists and 60 podiatrists practicing in Ontario. So as the podiatrists start to retire, that leaves less available practitioners to treat all the feet in Ontario. Particularly with our aging population, there is a significant need for qualified healthcare providers to offer foot and lower limb care. So according to a 2017 report from the College of Nurses, there is approximately, sorry, I cut it off, 1,300 nurses practicing foot and lower limb care, another 865 specialized in diabetic care, and about 14,000, just over 14,000 practicing wound care and pain management. Wound care and foot care does go hand in hand. So we will often recommend our students and nurses obtain additional education and training in wound care and refer them to the Canadian Association of Wound Care as well. It's definitely something valuable to add to a nurse's foot care practice. So this is one of our facilitators and her student. She was a nurse practitioner. She took our course in Burlington at the Burlington location, and but ortho nurses are definitely in need. So today I have a couple of videos to show you. This video was taken at my clinic with Nurse Kaylin, and this is just sort of a general foot care visit for one of our clients. So I'll just play that. And I'm feeling good. I'm feeling good. Fish in the sea, you know how I feel. River running free, you know how I feel. Blossom on a tree, you know how I feel. It's a new dawn, it's a new day, it's a new life for me. And I'm feeling good. Dragonfly out in the sun, you know what I mean, don't you know? Butterfly. Okay, and the next video I have for you is an ingrown toenail removal. What we do first is we'll cleanse the area, freeze with the topical solution, and there's some really great holistic topical freezing solutions now that are quite effective, and the client truly doesn't feel anything. We will debride any of the mycotic area, meaning the thick area of the nail plate if it's thickened. This one's not as thick as some that we see. Erin, my other nurse, did this ingrown toenail. So everybody has their own instrument of choice that they feel comfortable with. In our teaching program, we offer our students the opportunity to utilize different types of instruments to see which ones they feel the most comfortable with. And then if there's any bleeding, we would typically use silver nitrate or silver powder, which will stop the bleeding right away. Cleanse with an antiseptic and antimicrobial. If the wound is infected, apply dressing accordingly. If the ingrown is too involuted and it exceeds the competencies of the nurse, or it's too deep, nail bracing is an excellent alternative solution, which we're going to talk about in the next slide. And then you want to provide your client with health teaching for care at home and when to return for follow-up. And as always, if it's beyond your competencies, you can refer to another allied healthcare provider that can help this client. Erin did a great job there. So this next one is an involuted great toenail. So we're going to be applying a nail brace to this. The brace typically will stay on for 4 to 6 weeks, ideally. Sometimes they fall off a little quicker, so the client may need to come in sooner. But often our elderly clients will develop mycotic nails that are really, really thick, and they start to involute and grow into the corners. So a nail brace at that point in time can be quite helpful, and it will grow out as the nail grows out. So it's a non-invasive way to retrain the nail to grow flatter, if you will, and prevent reoccurrence.
Remove part of ingrown. Debride. Glue on nail brace. Hold the corners down. Wriggle. Tighten wire. Snip, snip. Cover exposed wire. Dry glue. Results in 6 to 8 weeks. Say goodbye to ingrowns.
So some of our facilitators will use a different type of product. There's some products that don't include the wire that are fairly effective as well. But this is offered through our training program as well. So there's lots of opportunities to see lots of ingrowns. They're very, very common. So some of the services offered by pedoortho nurses would include, as we discussed, medical foot care. So we would treat calluses, corns, ingrown toenails, thick mycotic nails. Diabetic foot care, we perform diabetic foot screens with our clients and vascular assessments, sensation assessments. We provide a great deal of health teaching with our clients, particularly if they have an insensate foot and have lost protective sensation, or if they have poor circulation and are at higher risk for ulceration, then we want to certainly address all of those issues with them during their visit. And as the nurse is providing the care, there's a lot of conversation and ongoing assessments that are being performed during the care as well. So pedoortho nurses can offer fungal laser treatments. There's also a new treatment that I don't have in my slides called ToeFX. So it's a highly effective product that is painted on the nail, and light therapy is used to destroy the microbes that are living in the matrix, germinal matrix area of the nail. So it's underneath the nail bed. So These additional adjunctive treatment options for your clients are quite effective, have been well researched and studied, and so that you can assist your clients with their desired results. And that some elderly clients don't really care about having a fungal nail, but again, if they're a high-risk client with diabetes, for example, or peripheral vascular disease, or has had a previous amputation, toe amputation, you definitely want to treat that infection. It can complicate issues if it's left untreated. And then we just talked about ingrown toenails, phototherapy, laser. So this is light therapy. It's a non-invasive treatment. What it does is it's kind of like photosynthesis in plants. So plants need sunlight for growth. So do the tissues, ligaments, muscles in our body, particularly when they've become injured. So what the light therapy does, there's a visible light, red light, and an infrared light, and it stimulates ATP production, which provides energy to the cells in our body. So it's assisting our structures to essentially heal themselves. It will increase collagen synthesis and rebuild connective tissue. It helps to promote microvascular circulation in the lower limbs and the toes. It's great for, we've had quite a bit of success treating diabetic neuropathy with phototherapy, and significant success with wound healing with our clients as well. And then we treat painful injuries with laser too. So as I mentioned earlier, plantar fasciitis is a very common foot injury that we see quite a bit of in the clinic. And then you can also see things like Morton's neuroma, that certainly needs to be treated with orthotic therapy as well, to deal with the biomechanical changes of the foot and to take pressure off the nerve endings. But yeah, laser therapy is an excellent treatment therapy for nurses to offer in their practice to help their clients. Shockwave therapy is a newer therapy that we've introduced into our clinic. I'm not sure if my other facilitators have introduced it. I know they have introduced laser. Shockwave is more for a younger clientele who wants to heal an injury really quickly. Shockwave can be quite beneficial as well. Custom orthotics. So I talked about this. Again, it's a very important treatment option for many clients, whether that's your diabetic that requires offloading from, let's say, a dropped metatarsal head or excessive pressure to the heel, or for a client who has injured their foot and we need to provide a supportive structure to prevent re-injury. So orthotics is truly a modality that nurses can offer in their practice. And as I mentioned, the Ontario Ortho Nursing Association has online courses for learning custom orthotics, and there will be in-person courses as well soon. And those are taught by doctors who have been working in the industry and educating in the industry for quite some time. So in terms of custom orthotic therapy, this is a 7-module online program, again, offered complimentary to our OPNA members. Compression socks. This is an excellent treatment therapy for people with lower limb edema, lymphedema, or venous complications. So this is something that can be offered by the nurse, especially if you have a client who is at risk for a venous ulcer, or someone that's got lower limb edema. But of course, proper assessments would need to be done, including an ankle brachial pressure index, to make sure that there's no arterial complications. in the lower limb, as that would be contraindicated. So this is something that we address in our program as well. And then wart treatments. So we use another type of laser that will coagulate the small blood vessels that feed the warts, and it will cause them to dry out. Okay, so I'd like to share this quote by George Bernard Shaw. I marvel that society would pay a surgeon a fortune to remove a person's leg, but nothing to save it. The role of the nurse is vitally important in these particular scenarios to help prevent more disastrous complications. So this is actually a picture of one of my clients, which I'm going to get into in the case study following this slide. So wound care is a complex management system, and it can be performed by RNs. RPNs can initiate wound care now, which is great. Thank you to WeRPN and Diane for your advocation. Nurse practitioners who have acquired the appropriate knowledge, skill, and judgment to do so. As I mentioned, we recommend additional training and education in wound care. And through the Canadian Association of Wound Care, there's programs that are quite effective and quite informative for nurses so that they can apply this to their practice. The ortho nurse will assess each client's overall health and wellness. We have to assess mobility. We have to understand biomechanics, particularly in these particular circumstances. Providing maintenance foot care to prevent potential complications. We need to make sure we're providing health teaching to our clients, and we address the foundations of wound care in our program. But because it is such a complex management system, it's truly its own entity, and we do recommend that nurses take this program as well. So as I mentioned, with our clients who have potential lower limb complications, we want to make sure that we're assessing the lower limb and the vascular status to identify factors that may affect their skin integrity, their nail integrity, nerves, veins and valves, arteries, capillaries, and their lymphatic flow. So an assessment could include addressing the immediate cause of the wound, any comorbidities, underlying pathology, local problems at the wound site, lower limb vascular status, risk assessment to prevent further tissue breakdown. We want to ensure there's no bacterial load, and if there is, we need to treat that. It's really important to discuss the patient's goals as well, and whether or not they can adhere to the nurse's plan of care. We assess exudate levels, granulation tissue. We want to make sure we're preventing pain. Some of the adjunctive therapies that nurses can offer in their practice would be, we use low-level laser therapy quite effectively with our wound care clients. Wound dressings, irrigation, debridement, offloading strategies, again, as I said, orthotics, orthopedic shoes, diabetic shoes, and solutions for pain management and referrals if necessary. It's important to address their nutritional and fluid intake as well. And that's that whole of patient care approach that a nurse provides is to offer, other health solutions and other strategies to help them improve their general health and overall being and their foot health. We want to make sure that we're talking to them about their lifestyle choices and refer to allied healthcare providers when necessary. So I wanted to share with you this client's journey with her wound. So this started as a callus before I saw her, and it became increasingly worse because she had lost protective sensation. So she truly didn't know what was going on, and a lot of our elderly clients can't get down to see what's going on. So when this patient presented to me, she had been to see 2 different doctors, and both of them wanted to remove her foot. And she was desperate to save it. I don't know how she found us, but she did. And this was truly a very rewarding experience for both her and I and the nurses in the clinic. So she was a diabetic. She had arterial disease. So she had a lot of comorbidities that created a higher risk of this not healing, essentially. She had already had this wound for over a year. So we decided to try to help her. Some of the interventions that we did was obviously cleansing the wound autolytically and sharp debriding. We provided low-level laser therapy and an offloading device. So we had her in a diabetic shoe, and you can actually kind of see it down below the diabetic shoes. So offloading is definitely, again, very important. Provided dressing. We addressed her exudate and bacterial burden. We provided health teaching. So she hadn't been drinking any water. Her nutrition was poor. So that's what we do as nurses, is we're providing that patient education to help them along the way. So as you can see, slowly but surely, this wound gradually healed over the course of a few months. And this patient was compliant because she could be adherent to the plan of care. So fortunately, we were able to save her limb, and she was ever so grateful. This is her other foot as well. So you can see she has an infection in all of her toenails. So that's where we come in. We need to remove some of this infected nail. And when we did, we can see that there was a wound developing underneath her nail. We provided her with digital appliances. You can see her 4th and 5th digit toes on the distal interphalangeal joint is compromised. The skin is breaking down because of the structural deformities that she has developed, potentially due to arthritis or poor fitting footwear throughout her life. So she's developed some hammer toes. You can see that one of the toes has already been amputated. And so we've been able to get her into a better place here. And she returns every 6 to 8 weeks for regular maintenance care. And that's what's so imperative about a nurse's care, is to maintain. So I want to talk to you a bit about private practice. A lot of my students will ask me, can a nurse own their own business? Can a nurse work independently in a private practice? And we're seeing, because there's such a vast community need for foot and lower limb care, that a lot of nurses have now, opened up their own private practices, which is wonderful. When someone can open up a private practice, such as mine, and some of my colleagues, we've been able to create that healthy work and personal life balance, which a lot of nurses, are sometimes missing, working night shifts and weekends and what have you. I mean, the job of a nurse can be very taxing, and that led me into more of a non-traditional nursing role in private practice. What I really love about working in a private practice is I can provide one-on-one client care. And sometimes my receptionist or my other nurses are like, come on, Erin, hurry up. I like to take my time with my clients so I can provide quality client care and address all of their issues, and you're not rushing off to another patient, provided you're scheduling them, accordingly. It is a positive work environment, and it allows the nurse to create their own positive work environment for both themselves, for their clients, and for their colleagues that they're working with. It's nice to be able to set your own hours and control your work schedule. What I find a lot of our students will do is they will still keep their main job, and they will do some foot care on the side. They might work at one of their facilitators' clinics. A lot of our facilitators will hire their students because there is such a great need, and everyone's clinics are super busy. So setting your own hours, it's perfect. A lot of our clients are seniors, so their schedules are pretty open. So you can say, hey, I'm going to do foot care on Mondays and Wednesdays, and then I'm going to do my other job the other days. So there's those opportunities as well. It's a way to earn a great income. And I know a lot of nurses feel uncomfortable about, making money for some reason, or nervous about making money, but your services are valued, and you have the right to earn an income and support yourself. So I always tell my students, don't feel bad about having to charge for your care. I mean, you're delivering excellent care to your clients. OPNA will be hosting our first annual conference this fall, and we're going to have some really great and interesting presenters, including we have some lawyers to talk about legal issues surrounding private practice, which I think is really, really important in this field particularly. It's extremely important to ensure that you are covered for liability insurance through either WeRPN or RNAO. Our students are required to have that insurance in order to participate in the clinical practice of our program. And just be part of your community and have fun. The top right-hand picture is myself, some of my staff, and our massage therapist was there. And we did a community run, and we wore our compression socks, which was great. It helped to promote the removal of lactic acid weights, because our legs were practically falling off after the end of the day. So opportunities for pedoral nurses, we get a lot of people contacting our association looking for nurses who've specialized in this area of care, and whether that be community home care, working in long-term care facilities, or in private practices and clinics, either working, as I said, a lot of our facilitators will hire our students, or potentially you may want to start up your own practice. And there's more and more hospitals that are sending their nurses to our program. So we're finding that hospitals are also looking for nurses who have specialized in this area of care. So I just want to quickly go over our curriculum. So as I mentioned, we wanted to standardize this curriculum and make sure that we were addressing and educating our students in all the areas of foot and lower limb care in order for nurses to ensure their competencies are met. So we go into ortho nurses' scope of practice and best practice guidelines. We go into the anatomy of the foot and lower limb, characteristics of the aging foot and lower limb. We discuss, we go into microbiology, infection prevention and control, occupational health and safety in this industry, patient foot health education, multidisciplinary health team concepts, biomechanics, gait analysis and orthotic therapy, nail and soft tissue pathology, structural deformities, and then we get into the high-risk conditions such as diabetes, vascular disorders, wound care and treatment, and then our clinical placement. So module, and what's nice about this program, and a lot of people I shouldn't say don't recognize this, but what we need to recognize is we're already nurses with valued skills and excellent entry to practice competencies. So what we're doing is we're building on that. And I think, judging the length of a program is not necessarily indicative of the quality of the program. I created this program so that our students could complete it in 3 weeks, or they can complete it in a year. So there's basically no rush. Nurses have busy schedules and often working while they're taking this program. So we've made this program very flexible. So our nurses can work around their own schedule to complete this program. So module 1 is 2 days of theory in the class. And we like to do it in the class because we're in the facilitators clinics. So we are working on some practice concepts, and we're, handling instruments and learning about all the different aspects of working in private practice. So we like to have our students in person. There is opportunities for online learning. However, we don't necessarily recommend it, but some of our teachers will offer that online. And in both in Ottawa, our facilitator Sarah offers it in both English and French. Module 2 is your 3 practicum days. So this is one-on-one skilled training in the clinic with one mentor. So it's booked with the clinic facility once the theory portion of the course is completed. There are multiple case studies to see with many different elements requiring pedortho nurses advanced care. The student will perform pedortho nursing assessments, patient care evaluation, patient health teaching, learn the documentation set up in the particular clinic that they are working out of. And all of this is observed by the instructor. Module 3 is the independent study portion. So this can be completed by the student at their own pace. So there are 17 chapters in my textbook, and there are questions and assignments to be completed and submitted to the instructor. And then we've also created some online documents that are fillable. So once our student registers online, they will have access to all of those documents. For example, we have assessment documents, nursing care plan documents. So the student would just go into their own portal, and they'll be able to pull off those practice documents as well. And then module 4 is an in-person exam, and that's typically booked on the last clinical day. However, it can be booked with whenever the student is ready to write the exam. And then once this is all completed, our students are provided with a 1-year complimentary membership to OPNA, and there are some additional online courses that OPNA requires our members to take, and that would include both orthotic therapy, gain analysis and biomechanics, and compression therapy. Okay, so here's our facilitators. So myself, Janice Boudreau, owns her multiple clinics actually in the Windsor, Ontario location, and has a number of, I don't even know how many she has now, but a number of long-term care contracts. So she's always looking for nurses, and she provides the education and training out of her clinics, both in the clinic and in the long-term care facilities as well. So it's an excellent opportunity to work with Janice. Sarah is in Ottawa. She owns Natural Soul and Wellness Clinic, and she has built a foot care practice fairly quickly in her community. They say if you build it, they will come. So she also offers some aesthetic services in her clinic as well, with a focus on foot care. Lisa Van Brett, she is an RN, a podorthist, and a podortho nurse. So she owned a orthotic clinic and decided to take the podortho nursing course to add additional services to her practice. She is very busy there, and she's out of London, Ontario. Sean Louis Size is one of my students and is now one of the facilitators. He has built a practice very, very quickly in North Bay, Ontario. I believe there was only one other foot clinic in North Bay. So northern communities are certainly underserviced, and Sean is doing very well and quite busy, and he educates students from North Bay and the surrounding area. Josie Hunter, she is the owner of Happy Feet Medical Foot Care Clinic in Alexandria, Ontario. She is very, very busy. And I believe she's hired a number of nurses now and has some long-term care contracts as well. Natalie Doucette is our facilitator from Oshawa, Ontario. Again, Natalie, I think she started not too long ago and has built up a very healthy practice and is quite busy, and is also always looking to hire her students as well. So these are some of the clinics that our nurses, facilitators, and or students, previous students own. Yeah, have set up their own clinic location. And that is it for me. If anyone is interested in registering for our program, I've got the website here for you. And it's all done online, and a welcome package and registration form would be sent to you to complete and send back. And that's it. Thank you.
Wonderful. I mean, I probably speak for others as well in that I'm just like overwhelmed by the scope that this encompassed. For some reason, I think, foot care, and that was so much more. It encompasses so much more than I'd even considered. And it's nice to see how important our nursing is to bring to that, but also that opportunity for, independent practice as well is a unique opportunity. So I can see on the screen, feetforlife.ca would be where they would be able to contact you, correct, Erin? And they can reach you through that website?
So the website for the school is feetforlifemedical.ca, and then it's /education. That takes you right to the school website. And then to contact me, let's see what I put here. Yeah, you can contact me at it's Feet for Life, FFLSPN at feetforlife.ca, and then there's our phone number there as well.
Okay, what I'm going to do is just wrap it up right now because we're a tiny bit over, and then I'm going to come back and because there are a couple of questions. So we'll just do kind of a wrap up first. And I just wanted to thank all of you who have attended today for giving us your valuable time. We know how busy you all are. And to our sponsor of this session, Erin King. So what I'll do is, Erin, if you can stop sharing your screen. Yep. And I will share my screen. So the winner of the draw for a self-care gift basket and a copy of Erin's published textbook, Feet for Life Podortho Nursing Advanced Foot and Lower Limb Care Textbook. The winner is Takashi Ikeno. So congratulations, Takashi. We will have your, our WeRPN people are going to give you a call to arrange for delivery of that, or however that gets sent out. So we appreciate that. Thank you again for your sponsorship. So I'm going to quickly jump back. I think in the chat, mostly everybody is saying thank you. We've also had some questions about whether the slide deck was available. But we, of course, this video will be available at the WeRPN website. We just need probably a day to get that up and running, so you can always access it through there. So quickly, the first question, which I can partially answer to, is does this continuing education, is it eligible for the NEI, the Nursing Education Initiative Grant Program? And I assume it is. Yes, exactly. It's furthering your nursing education. Again, it's not a guaranteed program, but yes, you can apply this furthering education to the NEI program. Are there any contraindications or side effects of using phototherapy to clients who have had any type of cancer? Is that a consideration?
Yes.
All right.
Yes.
So
it's not recommended to treat cancer patients.
Awesome. Tracy wants to know, Thunder Bay, yay, can I take it online and how do I find placement? So where would you send her for more information on that?
She can contact me directly at the email or the phone number provided. We do have students that come from a fair distance. Is Thunder Bay anywhere near Windsor though? I'm not sure.
Now we're asking those questions.
Yeah, I'm not sure, but
your placement though, your actual practicum is 3 consecutive days, is it?
Yeah.
So I guess you could do a lot of it back and forth and then dedicate a couple of days to your in-person, right?
Yeah, we can offer the online theory portion to her, and then we would book the 3 days consecutively. So you know, there would be a hotel involved kind of thing, and depending on which location she wishes to attend. But yeah, we will often do them 3 days in a row. Yeah.
Awesome. I was going to say, Tracy, if you look in the chat, I think somebody else just said they were up in North Bay. If you're already a certified foot care nurse, could there be exemptions to doing this course?
Yeah.
Oh,
absolutely. So
right.
There's we've designed a pedortho nursing pedortho or foot care nurse to pedortho nurse bridge program. So it's less expensive, and we just require their foot care certificate. And as I mentioned, everyone is required to obtain their WeRPN or RNAO membership for the liability insurance portion. But yeah, we certainly look at that, and it's at a reduced rate. Yeah.
Wonderful. I think that looks like it for our questions right now. That, yep, just let me make sure. Yes, it is. And in the chat, it is a lot of, yeah, not necessarily questions specifically. It's thank you, thank you, thank you, thank you is pretty much what the messages are in the chat. So wonderful.
What would you suggest for palliative treatment for pain, peripheral vascular disease? So do you have them in compression? Is it arterial or venous? Sorry.
We're going to get into specifics, aren't we?
Yeah.
All right. Well, we're waiting for
investigations. Oh, yeah. That's a tough one. That's, you know, feel free to send me an email and I can see if I can help you work through that. But
wonderful.
There'd have to be more patient details. Can I take, somebody said, can I take
the course and work for my community healthcare provider?
Oh, absolutely. I think there's a lot of opportunities working with even doctors. We'll hire nurses. Yeah, absolutely. There's lots of there's so much need for foot care. It's crazy.
I think this I was going to say this conversation, I think, has just sort of opened up a lot of, you know, thought paths for a lot of people. They're like, maybe I could do and do and do. So that's given them some resources, some information that obviously is valuable. I think to the consideration of how much this foot care impacts everything, you know, in nursing. And that's sort of a really important takeaway as well. So that's great. lovely presentation.
Oh,
Isn't
thank
that
you so
nice
much
to
for
see?
the nice comments. Thanks for coming, especially on this nice day.
I know. See, the sun is out for nurses this week. That's great. Thank
Mhm.
you so much. I'm sure we can go on with more questions, but we'll have to cut it right now. But thank you again, Erin. We really appreciate your time and your expertise here. And again, this is recorded, so we will have it up on our website. So you'll be able to come back and, see if there's things you missed there, because there was so much to take in. And we appreciate everybody. We hope you enjoy the rest of your nursing week. Visit our website to see what else is coming up. There are a few more events online. We'd love you to join us for those. And thank you to everybody. Thank you, Erin, and have a great rest of your day.
Enjoy
Enjoy.
your day.
Bye.
Bye-bye.